Are you thinking about starting a GLP-1 like Ozempic, Wegovy, or Mounjaro? Or maybe you've already started and you're wondering if you're doing it right. I'm gonna share the 6 biggest lessons I wish every patient knew. Hi, I'm Coach Chris, your Regenics Health Coach. At Regenics, we work with patients every day who are on GLP-1 medications, and my job is to help you avoid common mistakes and get the best results possible. So in this video, we are gonna talk about the things that can save you frustration, wasted time, and unnecessary side effects. So let's dive in. Number 1, weigh in weekly, not daily. One of the biggest mistakes people make on GLP-1s is stepping on the scale every single day, or worse, multiple times a day. Here's the problem. Your weight fluctuates naturally and throughout the day. So if you focus on scale numbers every day, you're probably setting yourself up for a terrible ride on an awful emotional roller coaster. Due to our normal weight fluctuations throughout the day, you're gonna feel frustrated and feel like you're not making progress. That will derail your motivation and throw off accurate progress tracking. Instead, weigh in once a week, on the same day at the same time. Overall, it's best to weigh yourself in the morning, after using the restroom, before consuming any liquids or food. When you zoom out and look at progress weekly or monthly instead of obsessing over minor pound fluctuations, you'll see more stable progress and it will keep your mindset much healthier. Number 2, don't rush your dose. Another mistake is upping your dose too quickly. Many people assume they have to increase every 4 weeks just because that's the standard titration schedule or what their friend did. But if your appetite is controlled, your cravings are quiet, and your weight is coming off, stay where you are with your dose. Ideally, we want to take the lowest dose of these medications and enact other lifestyle changes that are going to support your progress, like aiming for quality nutrition, getting quality sleep, prioritizing daily movement and resistance training, and getting ample hydration. The medication is an aid, not a magic shot. Even if the results seem slow, you may not need to increase your dose, especially if you aren't tightening up other areas like those I just mentioned. Remember, more medication does not equal faster, better results. Staying on a lower dose longer reduces side effects, allows your body to acclimate appropriately to the medication, and helps you keep your system stable. Only dose up when the results actually stop, and of course with your doctor's approval and recommendations. Patience can save you a lot of discomfort. Number 3, prioritize lean protein immediately. GLP-1s will naturally reduce caloric intake, but if you don't prioritize protein, you risk losing muscle along with fat. And muscle is what keeps you and your metabolism strong. To circle back, with jumping on the scale to weigh yourself and track progress, we also want to make sure that any lowering of the numbers on the scale isn't muscle loss. So it would be highly recommended to at least monthly find some place near you that does a more in-depth body composition analysis. At Regenics, we use a state-of-the-art 770 in-body scan that provides precise details of water, muscle, and fat weight, as well as some segmental analysis and comprehensive breakdown of total body composition. Finding an in-body near you or a place that does DEXA scans or a dunk tank could be extremely helpful in correctly tracking gains and losses. Overall though, build each meal around protein: chicken, fish, lean beef, eggs, or even high-quality protein supplement if food alone isn't enough. Also, get wild and broaden your protein game with, well, actual wild game meats like venison, bison, buffalo, elk, boar, or lamb. Hitting your protein goal makes the journey easier, keeps you full, helps you build muscle and burn fat, and protects your long-term results. Number 4, support your body with supplements. One of the most common complaints I hear is fatigue. That's often because your nutrition needs need to change when you're eating less. The supplements I recommend from day 1 are B12 for energy and mood, fiber to support digestion and prevent constipation, and a good multivitamin to cover the gaps from reduced food intake. At Regenics, we offer a variety of at-home vitamin injections you can utilize, like our BioBoost Plus, B12, L-carnitine, and NAD+, that can all help increase energy and metabolism and help you function properly day to day. Think of supplements as supplemental to your nutrition. If the quality of your nutrition is low, or you just don't feel like you're getting enough quality into your system, then consider supplementation. Number 5, take progress pictures and videos early. This one's not medical, but it might be the most motivating. Most people regret not taking before pictures or videos. You might not notice small changes in the mirror week to week, but when you look back at photos months later, the transformation is undeniable. Document your journey from the start. It will help keep you motivated, and if you ever hit a plateau, those pictures will remind you of how far you've come. Also, it's good to note here that we do have what are considered non-essential fat storage. So places like your cheeks, your neck, or even areas like your triceps or biceps may be where you lean out first. Places like stomach, love handles, or thighs may be a little bit slower to reduce. so it might be helpful to take tape measurements as well. Number 6, don't compare your journey to anyone else's. This is one of the hardest lessons to learn. Everyone's starting point is different, and rate of progress can also vary person to person. Hormones, metabolism, stress, sleep, and mindset can all impact your results differently. Comparing your success to someone else's results will only make you feel frustrated, and you really don't know the whole truth on what that other person is doing or what they're taking. It's better to focus on your own process, go at your own pace, and be invested in your own health. Your journey is unique, and that's exactly how it should be. So if you're starting GLP-1s, remember, weigh weekly, dose patiently, protect your muscle and metabolism with protein, supplement wisely, document your progress, and don't compare your journey to anyone else's. At Regenics, we specialize in helping people not just lose weight, but optimize their complete health. Prevention is power, and optimization is liberating. If you're ready to start your journey with the right support, check out the link below to learn how to connect with us. And if you want more clarity, watch our next video where I share the worst foods to eat on GLP-1. Don't forget to like, subscribe, and hit the bell so you never miss our women's health and GLP-1 content from Regenics. I'll see you in the next video.